that are located in predictable areas, right? And by influence on these ligaments, we will give a good support and hydration and also lifting effect to the ligaments. We will prolongate the use by producing collagen with superhydro. As we know, the product consists amino acids and peptides, and high and low molecular weight hyaluronic acid. Okay. I will mark on the face our points where we need to inject the product. First of all, we always inject a bit deep subdermal. Never inject superficial, so when you will see the papule on the face of the patient, it can be visible around the eye area. This is our orbital thickening ligament, but other papules shouldn't be visible. It means that you are deep enough to influence on our ligaments. So the first point, you need to outline the orbital rim like this and palpate it. Is it visible on the camera or not? Yes. Okay, good. So our first point of injection will be 1 centimeter from the lateral contours of the eye. It is an orbital thickening. And this will be our first point. We inject 0.2 milliliters in this area. You should palpate it and feel like elevation of the tissue, which is more firm. You can even try on yourself. Don't be afraid. Max, what you can do, you can catch the vein. If you see the vein, you do not inject, avoid, and inject close. Sometimes I can give influence on the temporal area because our fascia is very wide around the eye area, but also be careful with the veins. If you will follow this protocol, this will be 0.1 and 0.1 a bit higher. Sometimes we can inject, but let's follow the standard protocol. So the first point will be centimeter in front of the lateral contours of the eye. Please turn your face here. Next, we need to outline the jawline and angle. This will be our auricular platysma fascia. It's very wide, so we need to influence on it in 2 points. The first point will be on the angle of the jaw, and the other point will be 1.5 centimeters in front of the tragus. So 1, 2, 3. Then we need to find the McGregor's point. We can do this 2 ways. One is very easy way when we ask our patient to squeeze the teeth. Can you chew, please? And you palpate the masseter muscle. And you slide with your finger up to McGregor's point because our ligament is attached to this point and our skin not moving anymore. It's the same area where you inject the cheekbones, the filler. Or another case when we mainly find our McGregor's point and we inject. This is the same area. You can make a cross from the lateral contours of the eye down to the jawline and from the nose to the tragus. Or ask your patient to squeeze the teeth because anatomy is very variable, faces are different, so just check double check. We can inject at this point deep to the bone if we see the molar fat. Our patient doesn't have it, but sometimes for older people we see it. And of course, we will avoid the fat pads. Why? Because if we will inject in the fat, you will create the swollen to the patient. We don't need it. The patient doesn't need it. So we will inject just a bit deeply under the molar fat. And it's okay to give a good kind of projection with hydration if you touch the bone. The mesenteric cutaneous ligament will be 1 centimeter lower and 0.5 medially, and we inject 0.2 milliliters here as well. And then if you see the, even on our patient, she's young, but we can see the cheek fat, we will not inject in this area, do not create the swelling again. And from the angle of the lip, we go medially, 0.7 or 1 centimeter medially. This will be mandibular ligament. And the last point, where we inject only 0.1 milliliters, will be on the chin. We don't have ligament here, but we give a good projection and kind of lifting effect for the patient. We can see this beautiful picture of the connecting ligaments on our face, right? Do you have any questions about it? No? Translate, please.
I said that if you have any question, we can come with a microphone.
Yes, yeah, or later, or maybe now, because we follow our anatomy, so maybe you will have some questions.
We have one question.
Hello? No. I just wonder if when you inject the point close to the malar bag, if the patient doesn't have a malar bag, can't we inject
You can
deep as
inject subdermal as well. You cannot touch the bone. Just follow standard protocol.
So never go deep, only with the malar fat.
Yeah, kind of. Or you can go anyway. You will not create anything bad to the patient in this point.
All right, so it's okay to inject deep anyways.
Yes,
All
yes.
right.
But if you see the fat, of course, don't inject, because you don't want a kind of long rehabilitation for the patient. Nothing bad will happen, but patient will have swollen. What if the patient need to go out next day somewhere? Because our treatment this treatment can propose really a very good lifting effect and no rehabilitation. Patient can go anywhere, even like we discussed on the wedding. So yeah, just to avoid, if you see the fat pads and they are visible and patient is older, so of course just avoid it. Yeah, that's it. So each point we will inject 0.2 subdermal, and 1 point on the chin is 0.1 ml. Now we can clean our patient and we can start to inject. For these injections, the product is very viscous, so I take or 27 or 29 gauge needle. And I do not aspirate. If you have this question, we don't need to aspirate here. So this is our beautiful product. We'll see on the camera. We have 2.5 milliliters here already in syringe. We just need to take a needle. So I clean the face always. You have Horgexidine, it's very good. Use it all the time. So you even can put kind of a finger, and behind the finger you will inject. It helps you. It's about 1 centimeter. And we start. You see the level, right? You see the papule here because of anatomy. Not painful, right? Good. I usually hold also with my finger and inject. Sometimes you can touch the bone, but usually it's not too needed. No papule, right? It's spreading. If you see it here, it will go away till the evening. Sometimes the papule can be bigger, but anyway, it will pass till tomorrow. So now we have 1.5 centimeters here. Usually control myself with the finger. Yes.
Do we need to pull the chair a little bit more, or is it okay like this?
No, for her, the chair is okay. Yes, yes, thank you. It's comfortable for me because she's right in front of my arms. I do not go to the bone here. This is our mesenteric cutaneous ligament. Are you okay? And mandibular. Here may be just a bit unpleasant for the patient. When you find ligaments, you mark them, and this injection will be like when they are found already. This will be fast for you. With the practice, you don't need to mark, of course. You will just understand the points, and treatment give a good result for the patient, and very fast. So now we will start with another side. And I will just repeat the points. The chin I usually inject at the end. Okay, let's go from this side. Now turn your face here, please. So, orbital thickening. Sorry if I'm covering with my hand, but this is how it should be. You okay here? Auricular platysma fascia to the angle. And 1.5 centimeters in front of the tragus. Thank you for helping me. Zygomatic ligament. Mesenteric cutaneous ligament. Okay.
Yeah.
Mandibular ligament. So and now we have 0.1, maybe just a bit more. As I said, products sometimes have more milliliters. And now we will just inject on the chin. Not deep, not to the bone. Sometimes you feel like your hands are really shaking because the product is very viscous. So take maybe 29 gauge needle. It will help you. Don't need to suffer. And it will be faster. So I'm just really pushing hard. Good. That's it. We give recommendation to our patient: do not take sauna spa for 1 week, do not go to gym, do not drink alcohol for 3 days.
No gym for a week?
No gym for 3 days. But okay, if yoga, Pilates, yes. But if you lifting weights and sweating a lot, better to avoid it. At least couple days. On the 3rd day you can go.